Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Today in Neighborhood Health Watch, we're talking about the prevention of colon cancer and early screening techniques. Dr. Cary Gentry is joining us from Retreat Hospital. He is a colon and rectal specialist. Let's start, Dr. Gentry, by defining exactly what colon cancer is and how does it typically start?
Well, Diane, this month is Colorectal Cancer Awareness Month, and unfortunately each year about 140,000 patients are diagnosed with colon cancer. That's too high, and I think we can do better if physicians and patients work together to identify it.
Now, typically there aren't any symptoms.
Right.
When there are, what should a person be alarmed by?
Well, the screening guidelines are that patients should be checked starting at age 50 with a colonoscopy. However, if you have a family history or you have symptoms, even if you're younger than the age of 50, you need to be checked. Most colon cancers start as a polyp, and so colonoscopy is not only diagnostic but therapeutic. So when you do a colonoscopy, we look for polyps, we remove those polyps. In doing so, you prevent cancer, and that's the importance of screening, particularly early.
What are the causes? Is it typically hereditary or lifestyle?
There's two hits. It's usually either the family history or environment. There is some association with smoking. We do see high-fat diets tend to be a cause as well. But anyone with a family history needs to be more vigilant. We recommend that folks who have family members with cancer get screened 10 years younger than the age of the diagnosis.
And who's most at risk?
Most patients who are in family histories are most at risk. We are seeing some data that supports African American and Hispanic patients being screened earlier because of genetic causes as well.
And what is there a possibility for self-maintenance to deal with it without having to see a doctor, or that's not?
Well, we recommend that patients see their primary care physician. There is a new technology out that's looking at the DNA, or the protein in stool that detects polyps. And if you can identify them early, it would force folks to get screened earlier. So there is screening with every test should be done with a physician guidance.
And what type of things can you do to prepare if you recognize some of the symptoms that we just discussed? What things can you do to prepare for that doctor visit?
Well, we want to alleviate the fears first off.
Right.
There's two big fears. Patients are afraid of the prep that you have to do, and they're afraid of the anesthesia. And if you look at the new preps out, you only take 5 ounces of prep, which used to have to take a gallon.
That's a big difference, yes. I remember that with my dad, yes.
Used to have to do a gallon, and the anesthesia is better too. The anesthesia is clean, you're only asleep for 10 to 15 minutes, and there's no pain.
So don't be afraid to follow up on symptoms that you might be experiencing.
Exactly.
Get the diagnosis from the doctor, and it's easy to make that diagnosis. It's not as if you have to, it's not a guessing game.
Right, it's much easier to treat the patient with polyps than wait till they get cancer.
Right.
So get it early.
All right, thank you so much for joining us. We appreciate it.